Okay, let's dive right into this explainer. For decades, the medical world has relied on a really, deeply flawed system to track smoking: human memory. But today, we're looking at a fascinating piece of tech called SmartPuff. It's designed to shift us from just guessing to actually knowing, and it does this by introducing what's called the Digital Smoking Exposure Index.
So here's our roadmap for today. 1. The problem with counting. 2. The digital biomarker. 3. The nanosensor stack. 4. Predictive AI logic. And finally 5. The future of cessation.
All right, Section 1. The problem with counting and why the whole a pack a day metric is dangerously inaccurate.
Tobacco use causes over 8 million deaths every single year. It's a staggering number. Yet despite this massive mortality rate, our primary way of monitoring it is, well, it's shockingly primitive. We literally just ask people to remember how much they smoked. Crazy, right?
So it begs the question, how do you accurately measure a deadly habit? When a doctor asks a patient for their daily count, that reliance on self-reporting introduces massive recall bias. I mean, think about it. Most of us can't even remember exactly what we had for lunch yesterday, let alone every single cigarette we've smoked over a week. You just can't build an accurate medical profile on a guess.
And you can see the massive disconnect here. A patient might just casually check a box that says 20 cigarettes a day. But that simple tally, it completely fails to capture the real story, the intensity of their drags, the depth of the inhalations, and the actual toxic load that's building up in their lungs. Which brings us to Section 2, the digital biomarker. This is where we move beyond simple cigarette counting. To fix this guessing game, SmartPuff introduces the DSEI, or Digital Smoking Exposure Index. And to be clear, this is not just a digital calorie counter on your phone. It is a true digital biomarker. Look, a doctor wouldn't ask you to just guess your blood pressure or cholesterol, right? The DSEI treats smoking exposure with that exact same clinical precision, measuring actual toxic exposure rather than just the number of sticks consumed.
So instead of a flat 20 a day, this index is continuously tracking things like exact inhalations, overall toxicant exposure, smoking intensity, estimated nicotine dose, and your carbon monoxide burden. It pieces together a clinically undeniable picture of your actual behavioral dependence.
Let's move to Section 3, the nanosensor stack. This is all about how we physically capture the puff.
Every single drag takes this amazing chronological journey. First, the user inhales through a universal smart mouthpiece and filter. Instantly, a suite of advanced nanosensors measures the physical and chemical properties of that exact puff. Then, bam, that data is wirelessly transmitted via Bluetooth straight to a mobile app. The user doesn't log a thing, the tracking is totally invisible and continuous.
Now inside that mouthpiece is a highly specialized nanostack doing the heavy lifting, and this is where it gets really cool. A MEMS pressure sensor perfectly calibrates the exact airflow and duration of the drag. Then you've got a highly sensitive graphene gas sensor, detecting volatile organic compounds, or VOCs, which gives a real-time window into toxic exposure. Right next to that, a dedicated nanosensor measures the carbon monoxide burden hitting the lungs, and a temperature sensor gauges smoking intensity. It's literally capturing the duration, the heat, and the exact toxic load of every single puff.
Because of these sensors, continuous, objective monitoring finally replaces those old reactive questionnaires. It takes the guesswork out of the equation completely. Clinicians now have the actual ability to assess smoking behavior between visits, knowing exactly what happened, when it happened, and with what intensity.
All right, Section 4, predictive AI logic, the absolute brain of the operation.
All that raw sensor data we just talked about feeds directly into an AI behavioral analytics platform, and this is where the magic really happens. This AI engine doesn't just log the past, it actually predicts the future. By analyzing the logic of your specific habit, like, say, how a sudden spike in your puff temperature and airflow might signal heightened stress or withdrawal, the AI maps out your psychological dependence. It can actually predict when smoking cravings will hit, calculate your probability of a relapse, and generate a real-time quit readiness score. This is a real game changer because it shifts healthcare from being reactive to preventive. Right now, a patient fails to quit, goes back to the doctor weeks later, and tries again. But because this AI engine recognizes stress patterns and predicts those cravings before they overwhelm the user, it triggers real-time, actionable interventions right on your phone. It gives people a fighting chance to stop a relapse before it even happens.
And to support all this, these predictive models live in a highly scalable cloud ecosystem. The data feeds straight into a mobile app to help the individual quit in real time while simultaneously allowing doctors to monitor their patients through a clinical risk dashboard. Plus, zooming out, public health agencies can use this anonymized data to spot behavioral trends across entire populations.
Which leads perfectly into Section 5, the future of cessation and scaling public health. Because SmartPuff gives us a standardized digital biomarker, the potential applications here are just massive. Sure, it can revolutionize smoking cessation clinics, but think bigger. Corporate wellness programs can objectively track employee health. Insurance providers could base premiums on verified cessation data rather than just the honor system. Even pharmaceutical companies can finally use hard objective data to prove their new cessation drugs actually work in clinical trials.
And getting this tech out of the lab and into the real world is on a super fast track. The roadmap outlines a brisk 24-month path. The first 6 months are all about prototyping and rigorously validating those graphene and MEMS sensors. From there, it jumps into clinical pilots and refining the AI models, aiming for multi-center validation and a full commercial launch of the medical device within 2 years.
The long-term vision here is incredibly ambitious, but clear. SmartPuff aims to become the global standard for objective tobacco exposure measurement, replacing self-reported cigarette counts with continuous digital biomarkers. The ultimate goal? Reduce the massive global burden of tobacco-related disease by shifting away from flawed human memory to AI-driven truth.
Which leaves us with one final, pretty provocative thought. Will the end of the tobacco epidemic begin with a single, digitally monitored puff? When you combine cutting-edge nanotechnology with predictive AI, you really have to wonder just how fast we can improve preventative healthcare once we finally stop guessing and start measuring. Thank you so much for joining me for this explainer. I hope it gave you a clear, exciting look into the future of digital health.